This is Libby, and I'm going to be looking at illness and injury in the trenches. In the trenches, soldiers were regularly exposed to illness, infection, and gas attacks. As well as having short and long-term physical consequences, these conditions also put the emotional health of soldiers at risk. Many soldiers suffered from cold exposure in the trenches. Trench foot was also caused by spending too long in flooded trenches. Skin and tissue in the feet could become gangrenous, and doctors would sometimes have to use amputation to prevent the gangrene spreading. Unclean water and unhygienic latrines helped dysentery spread in the trenches. This disease caused diarrhea and dehydration. Vermin in the trenches, such as rats, lice, and fleas, spread diseases such as trench fever and typhus. There were four main gas weapons which were used during the war. These were lacrimatory or tear gas, which was meant to disable instead of kill. This gas caused inflammation of the nose, throat, and lungs. There was mustard gas, which was a blistering agent that caused burning, blisters, breathing difficulties, and if exposed for an extended period of time, blindness and lung infections. There was phosgene, which caused suffocation and was hard to detect because it was colourless, had a mild scent, and symptoms were delayed. And chlorine gas, which was a killing agent that suffocated its victims slowly. Shell shock is a psychological illness caused by exposure to death, destruction, and artillery bombardment. There was debate about whether shell shock was caused by unseen physical injuries or emotional trauma. And symptoms of shell shock included blindness, fatigue, deafness, shaking, and mental breakdown. So I just mentioned these four different types of gas weapons during the war, and these included phosgene, lacrimatory gas, and chlorine gas, as well as mustard gas. So unclean water and unhygienic latrines helped dysentery, which is general waste spread in the trenches, and this disease caused diarrhea and dehydration. Wounds and injuries. Trench warfare resulted in a frequency of severe injuries that had not been seen before. Gunfire and shell explosion caused many of these injuries, and the situation was made much worse by these wounds regularly becoming infected. Gunfire caused gunshot wounds, fractures, bruises, and organ damage. The bodies of the soldiers were often protected by the trenches, but their heads were exposed, and so there were an alarming amount of head injuries. Shrapnel, which is metal objects and fragments from explosions, caused severe facial injuries and could even kill. Shrapnel shells were filled with bullets and metal balls which flew out in all directions when blown open in the air. Other shells exploded violently, causing their cases to break into large pieces of shrapnel. Shell explosions also caused soldiers to get concussed, be hit by debris, buried under collapsed trenches, or be poisoned by carbon monoxide. Many trenches were built in farmland that was covered in bacteria from fertilizers. Unhygienic latrines and bodies dug in shallow graves near the trenches made the situation worse. Serious infections like tetanus and gas gangrene were common because the wounded often had to lie in the contaminated mud for hours before being rescued. These infections could cause sepsis and could even be fatal. The tactics for fighting infection at the start of the war were: the anti-tetanus serum was taken by soldiers to stop tetanus, washing wounds in an antiseptic solution called carbolic lotion, and then closing them up and wrapping them in bandages soaked in carbolic acid. Wounds were also covered in paraffin paste called BIP, and amputations prevented the spread of life-threatening infections. So, as we learned, shrapnel are the metal objects and fragments from explosions, which can cause damage to the face. We also learned that many trenches were built in farmland, which was covered in bacteria from fertilizers, and this could increase the risk of wound infection. So, developments in surgery and medicine during the war. Doctors continued to develop new techniques throughout the war that gradually improved the way injuries and infections were dealt with. I spoke about this in the episode before this, talking about the impact of World War I, which you can listen or watch to if you'd like. X-rays helped improve the treatment of bone fractures. War hospitals used X-ray machines to locate broken bones and shrapnel in patients. The Thomas splint helped improve the treatment of bone fractures. The Thomas splint protected the leg from further damage by immobilizing the leg before the wounded man was moved. The Thomas splint reduced the number of fatalities caused by femur fractures in the trenches from 80% to 20%. Syringe cannula blood transfusions. So at the start of the war, blood was directly transfused from one person to another. This process was slow and often unsuccessful. The syringe cannula technique improved success rates. This involved taking blood from a donor using a needle and syringe before quickly transfusing it. The difficulty was that blood could clot in the syringe. In 1917, it was suggested that it would be ideal to collect blood in advance of when it would be needed. This resulted in the first blood bank being set up before the Battle of Cambrai. During the war, Antoine Depage, a Belgian doctor, decided it would be best to treat every wound as infected. As a result, he developed the following treatment process. First of all, thoroughly exploring the wound and removing shrapnel and bits of clothing. Then, leaving the wound open to the air for 24 to 48 hours. So, as we learned, the Thomas splint was the splint that reduced the number of fatalities caused by femur fractures in the Western Front from 80% to 20%. We also know that war hospitals used X-ray machines to locate broken bones and any shrapnel that could be in the patient's body. And as we spoke earlier about the conditions in the trenches, we know that trench foot is a disease that was caused by standing in flooded trenches for too long. And one of the more drastic procedures was amputation, which was used to prevent the spread of a life-threatening infection. So what techniques would help improve the treatment of bone fractures during the war? As I just mentioned, we know the Thomas splint was used, and we also know that X-rays were used, as they could identify the fractures quite easily. So that's all for illness and injury in the trenches, and that brings this topic, treatment in World War I, to a close. Thanks for listening.